everyone, and compliments of the season. I'm Dr. David Ajibade with the Brain and Body Foundation, and this is your health in your hands. I hope all of you are staying safe. I hope you had a wonderful Christmas, and the New Year's is meeting you well and healthy. Now, if you remember, we had Dr. Badamosi on. Let me quickly read out who he is. He is the Medical Director, Division of Pulmonary and Critical Care Medicine at JPS Health Network in Fort Worth, Texas. Brilliant, brilliant physician. And he, probably more than anybody else I know, is right there in the front, in the center of it all when it comes to COVID-19, because of course, COVID-19 is primarily a respiratory problem. We talked about a few things last time he was on, and I just felt there was a lot left on the table that if we didn't take advantage of while I have him, I just felt I would be very, very unhappy. So I think you would be robbed too of all the wonderful information that can still come out of this. So I asked him, and he gracefully agreed to do a few more sessions to really educate us about COVID-19 and how that impacts you, your family, the rest of the world, because this is truly a unique disease. And most doctors I speak to, I hear about, I listen to, they say there has never been a disease like this. And there probably never will be in their lifetimes. So it's important that we understand this and the implications it has for our health going forward. So Dr. Badamosi, thank you again for making this possible. We really appreciate you.
Thank you for having me.
Sure. So one of the things we talked about before we went live was that of the stress, the emotional toll that COVID-19 takes upon not just the individual himself or herself, but on the family. Can we talk about that a little bit more?
Yes, thank you so much for asking that. I think what I want your viewers to understand about this disease process is majority of the people that actually have this disease will be fine. They will only end up with a mild disease and they will be fine, they will recover. But there's a significant number of people in the prime of their lives with hypertension, diabetes, even probably well controlled or a little bit overweight that will have severe disease. And these are people's uncle, aunt, mother, husband, father, grandparents that come to us with severe disease. And the difficulty with this disease is, first, when patients are sick, severely ill, or critically ill with COVID-19, family is not there. They cannot help them. They cannot hold their hands. They cannot have any last-minute exchanges they will want to have, despite knowing, unfortunately, in some instances that they are not going to make it. That is one. The second thing is the care providers themselves, doctors, nurses, respiratory therapists, pharmacists, all over the world taking care of this patient. Really see a patient walking with just a cough and maybe a little bit of shortness of breath on day one. And people still maintain their personality, they maintain relationship, they're able to talk to their care providers by day one, day two, day three. Of course, as the disease severity progresses, you start seeing patients that you really come to know and establish a relationship with, and seeing them appropriately as human beings progressively deteriorate and pass on from this. The impact of that on the care providers, believe me, it is really, really severe. Now multiply this by having a lot of patients come in, not survive, and expire. And it really dovetails to the issue of, yes, even though a lot of people may not be affected by this, but it's still really, really important for them to participate in preventing this tragedy. By following the local health recommendation, by following the guidelines of their doctors, their healthcare practitioner, government regulation, and local government regulation, wherever they may be, in regards to how best to limit the spread of this disease. A lot of people should not be in denial. that this is not existing, but for the grace of God, they have been spared. And I think that recognition of grace should be understood by all. And everybody should do everything within their power to limit the spread of the disease. They may not have severe disease. They may not have critical illness from this disease. They may not even know anybody that have been through it. But a lot of families during this holiday period have empty chairs in their houses. A lot of families are grieving, some publicly, most privately. So I think, if for nothing more, out of respect for those family, people should acknowledge this is real and do their part to prevent the spread of this disease.
Absolutely. Thank you for pointing that out. And I do. Before we go into the break, I do want to ask: have you ever experienced any other kind of disease like that has this kind of emotional toll, like what you described in your practice as a pulmonologist?
No, no. And I've been doing this for quite a while now. I have never seen anything like this before. And it's such a devastating, terrible disease. Most people that come with severe disease into the hospital, even amongst those that survive, what people fail to realize is a substantial number of people that survive COVID still have significant lung changes and scarring that's
Mm,
going to really start picking up again down the line, because
mm,
there will be some form of limitation in the ability to do work, to get on with their normal activities without being short of breath down the road. So that they survive, thankfully, that's a great thing. But they are not usually fully out of the woods, because the lung is a terribly unforgiving organ. Once it is damaged, it heals with the scar tissue. It doesn't regenerate itself. So all
mm.
of those lung damages from COVID-19, even in the survivor of this disease, still there is a consequence for that down the road. And your viewers should realize that people will start needing oxygen. People's activities will be limited from this COVID disease for a long time.
I hear you. And I understand is the lungs are not the only casualty of war. We hear about mental health experts too talking about the long-term mental health effects of the disease, everything from PTSD to depression to other conditions as well. So yeah, we are dealing with this is nothing to laugh about. Folks, we're going to take a quick break. Don't go away because we're going to be talking about the virus specifically and how it affects the lungs. So stay tuned. All right, welcome back, folks. We are here with Dr. Badamosi. Let's talk about the virus. Virus, let's take us through this, how it affects the body.
Yes, so I'm gonna like to share some of my slides, maybe for your viewers. Perhaps that will really help them visualize exactly what I'm talking about and provide a context to everything. I will try as much as I can to speak in as much simple, non-medical terminologies as I can.
Thank
But
you. Thank
hopefully
you.
that should help. So I have some slides up now just to kind of like show where we are. So again, so COVID-19, as everybody knows, really is belongs to the family of the coronavirus, and we've also heard of the SARS that devastated Asia and Canada and northern parts of the United States in 2002, and of course the Middle East respiratory syndrome. All of these three viruses belong to the coronavirus group of viruses. They are quite highly contagious. And the Middle East respiratory virus, everybody will know, affected Saudi Arabia and other parts of the Middle East, was spread from camels. That's the thought. Now you can see I have this timeline here for your viewers to kind of like see that we've known about the coronavirus for a long time, since around the 1930s. And most of these other viruses, coronavirus group, they basically just cause upper respiratory tract infection, like common cold, catarrh, and cough for a few days, and it goes away by themselves. The first time we knew we were getting in trouble with the coronavirus was sometimes between 2002 2003, with the emergence of the SARS-CoV-1, right? That is the virus that caused the SARS. That led to a lot of respiratory failure, especially in Asia, Hong Kong, China. They had Taiwan, they had a lot of illnesses from these parts of Canada and United States also experienced this between 2002 and 2003. Then 10 years later in 2012, that's when the MERS-CoV emerged from. This is the Middle East respiratory virus, also belonging to the family of coronaviruses. Then we have the SARS-CoV-2 coming up at the later part of 2019, emerging first in Wuhan, China, as everybody know by this time. And of course, we are still in the pandemic of the coronavirus. So the reason I brought that up is to show all of those is there is still a whole lot more coronavirus from where those came from. So everybody, so as this is coming, there should be no surprise that over the last 20 years, we've had new coronaviruses every 10 years or thereabout. So there should be no surprise, even another 10 years. I honestly hope not that there's another emergence. And there's usually an animal intermediary, bats in the case of SARS-CoV that we are dealing with now, and of course the pangolin and of course the camels in the MERS-CoV virus. Now, this is the virus which everybody knows by now. I mean, if you've seen CNN or any other media, you've seen a shape of this cartoon of the virus itself. Basically, it's an RNA virus. This is the genetic code right here, and it has some protein on the surface of it that's sticking out. And this is much more important when you talk about the vaccine of the virus against the virus. The real thing does not look nearly as beautiful as the cartoon I just showed you. You can see it in its ugly form here, and you can see those spike protein right on top there. And this is it in the human tissue. After infecting a human cell, you can see a lot of the viruses inside the cell about to rupture to release other viral particles that will go on to infect other cells. So again, from my perspective, as a pulmonologist, the way I look at the lung is basically there is an air sac here that air comes in and goes, and there is a blood vessel surrounding the air sac. And so this brings in oxygen poor blood, right? Blood that oxygen has been removed from. And the oxygen now moves from this alveolar air sac into the blood vessel, and carbon dioxide moves back out. You can see the normal lining of this sac here. It's very normal and healthy. With SARS-CoV and other viruses that damage the lung, they basically just damage the cell lining this sac around the lung and the fine sacs of the lungs. Right there, you can see they're all destroyed. This blood vessel that is nice and smooth is also destroyed. And you have inflammatory cells really come by and start fighting the virus. But in the process, they destroy both the lung tissue and also the blood vessels itself. So again, this is the same thing. Looking at the virus itself, it enters the host cell, which is again our human cell of the lining of our airways. It takes over the cell and it replicates itself, and it releases daughter cells that go on to infect other cells here. And ultimately, what do you have? You have a lot of damage to the blood vessel that is surrounding each of the respiratory sacs. And also you have damage to the lining of the respiratory system itself. This is the same thing I'm showing. So when you look at a CT scan of the chest, what you see basically is inflammation of the lung, as you can see right here. At about the 5th day, you can see just some sparse inflammation. The normal lung should look black, the way you are seeing this here. So you can see the inflammation here is very, very mild and sparse. But here, pardon me?
What's that in the center? Is that the heart?
Yeah, that's the heart and some of the great blood vessels around the heart. And here by day 21, the same patient, and this disease typically lasts around 3 weeks in the severe cases or more. By day 21, you can start seeing here that the inflammation is a whole lot more. Some of this initial inflammation have now turned into scar tissue. You can see a whole lot more white in the lung, that normally you would expect to see with that normally you will not be seeing in the lung. So you can see the infection is not resolving at all, and the lung is now being destroyed and replaced with scar tissue. So this is another CT scan. In the early part of the COVID-19 infection of the lung, again, the inflammation is very, very minimal and is mild. And patient can still breathe normally, albeit they will know and feel that all is not well with their lungs. But as the infection progresses, it gets worse, and they have a lot of collapse of the lower part of their lung. Fluid is in their lung. Most of the lungs are destroyed. You can see the white part here.
Real quick, why is it the lower parts? To me, I look at it and I see that as the back of the lungs.
Correct. So again, it's just gravity, right? Any little water in the lung will always find its level. It will go to the bottom of the lung, and that's where people are laying down more. And that's why sometimes we tell people to sleep on their stomach, right? To cause a little bit more redistribution and help with the gas exchange. Um, so here again is another CT scan. These white dots here that you're seeing is really blood vessels that are enlarged more than normal. And this is the inflammation and damage caused by the COVID-19. If you use a dual energy CT scan, which is what they used in this case, you can see clearly what happens in the lungs. This dark patchy part here, there is no blood flow going there. This orange part, there is a lot of blood flow. You can correlate it with this. The area of abnormality corresponds to the area of reduced or completely absent blood flow in the lungs. Why is that so? You can also see this little part here, there is no blood flow. So the reason is if you look in the lung tissue, you can see a lot of blood clots within the lungs that is really blocking blood vessels. The tiny blood vessels that are supplying this area are not able to get blood flow to them so they can really release the carbon dioxide in them and get fresh oxygen in. So even though the patient is able to breathe normally, that's the way they will present, but they are not able to get oxygen into their blood because there are a lot of small blood clots within the blood vessels of their lung that prevents blood from getting to the correct site where it needs to get to really unload the carbon dioxide and pick up oxygen from the lung. So their blood oxygen is low, but they can breathe okay. So that sometimes if people have been listening to news or reading some medical journals, those are the people that are called the happy hypoxics. Hypoxic means their blood oxygen is low, but they are not feeling as though they cannot breathe properly. This is seen usually in the early phases of COVID-19 pneumonia.
Is this unique to COVID-19 or have you
This
seen
is
that?
unique to COVID. This is unique to COVID-19. This is
Okay.
unique to COVID-19. Unfortunately, you do see this, but to a much lesser extent in influenza pneumonia and other type of ARDS. So I would like your viewers to also see this blood vessel here. That it's really damaged. It's significantly damaged because of the virus that has infected it. Now, the
And
consequences.
remind us that what's that big gap and space what are these big white spaces? Are those
That is the air sac. That is
yeah,
where air normally is that interacts with the blood with the blood vessel there. Yes.
okay.
And so ultimately, this is why we breathe. Essentially, you get air into this space, blood is flowing here, oxygen diffuses into the blood, carbon dioxide diffuses back into the air. You get fresh oxygen in your blood. It goes to your heart. The heart pumps fresh oxygen back to the rest of the body, and carbon dioxide will breathe out. So remember how I mentioned that there is destruction of blood vessels in the lung with COVID-19. The body tries to regenerate itself, tries to make new blood vessel. And but the problem is these new blood vessels are so new and fragile and so young that they can rupture easily. So sometimes, even though you do see blood clots in the lungs of patients with COVID, you also will see some bleeding. So balancing the two is very difficult. And Dr. Ajibade, based on the question you asked earlier, this is kind of like the amount or the density of new blood vessel that is formed in the lung of a patient in COVID compared to if somebody just had plain good old influenza. So you can see it's many folds more, which is
Mm.
something that prior to now we didn't used to see. So these new blood vessels that are formed are really very, very fragile and they can rupture. And it's not unusual to see a patient with COVID-19 cough up some blood. But of course, they are still forming blood clot. And we are in a situation where we need to decide, do we give them blood thinners so they're not going to form clot? Or do we just wait and hope that they stop bleeding? Which is one of the management challenges with this disease. So basically, that is essentially what you have with COVID-19 in terms of what it causes and how it affects the lung. And in summary, there are a lot of coronaviruses. We've had three that affect the human lung now in a very terrible way. The SARS-CoV-1, the MERS-CoV, now is the SARS-CoV-2 that causes COVID-19. And the way they kind of like, we have those viruses every 10 years. There's still more where this comes from. So which is really why we need to be prepared, and we really need to be aware that there's possibility that unfortunately down the road we may have other respiratory viruses that can cause more global pandemics. But for now, what we have is what we have. And my best view, my best opinion and suggestion to your viewers is to follow the local guidelines of healthcare recommendation. Realize that, yes, fortunately, and we have been protected in sub-Saharan Africa, Nigeria specifically, for reasons that people still not completely understand. We have been very fortunate, but that does not mean this virus is not real. You still have to socially distance, you have to wear your mask, you have to follow recommendation of the local health authorities and the government recommendation. Remember, while you may not have this disease, while you may have a mild disease, you can spread it to people that are susceptible and are likely to develop severe disease and possibly even die from this disease. And if and when vaccination is available, please get vaccinated as soon as you are able to. That will also limit the spread of this.
You, Dr. Badamosi, that it cannot be overemphasized what you just said. And thank you for that masterful description of how COVID-19 affects the body. Yeah, I know it's still a mystery how we are still so spared in sub-Saharan Africa. Lots of theories, obviously, everything from vitamin D to our diet to our fact that we're a younger population and all sorts and all sorts. But BCG is another, the BCG vaccine, you've heard that one too, right? So there's all sorts. Well, we're about to close now, but real quick, why is hypertension, if you can answer that briefly, why is hypertension such a high risk? I mean, I can understand lung disease. I can even understand diabetes. I can understand cardiac disease. Why hypertension being such a high risk?
That's a very good question. And it's mainly two reasons. So far that is known. I'm sure more will be figured out. Now, if you look at the prevalence of hypertension in any society, hypertension is commoner the older you are. The prevalence of hypertension becomes more and more common as people get older. So because you see hypertension in old people, and so both hypertension and old age are risk factor for this disease, or at least severe COVID-19, and they go together. It's difficult to tease out. Are we just seeing the fact that hypertension is more common in old people and hypertension is not much of a risk factor in and of by itself? There are still data coming out, but there's a lot of suspicion that is because hypertension is more common the older you are.
Okay.
The second thing is the receptor, that is where the virus binds to the surface of the cell to enter the cell. It binds to a receptor that's called the ACE2 receptor. This receptor is also an enzyme, and it helps reduce complication from hypertension. It's part of the pathway that mediates and control human blood pressure and inflammation. So it's thought that there's a complex interaction between the virus really destroying that receptor as it goes into the cell, and it seems that there is less of that receptor. So in the absence of that receptor, which is also an enzyme to work the way it normally will, that predisposes hypertensives to having more severe disease. It's still very complex. It's not fully teased out, but that is just two of the theories that are out there now. But there's additional data coming. But certainly, hypertension is a risk factor for severe COVID. Right. That is what we know now.
Well, then thank you for explaining that because now you've explained that the receptor is both a receptor and an enzyme.
And an enzyme, yes.
That's interesting. That's interesting.
So for everybody that is taking losartan, valsartan, captopril, lisinopril, and all of those is all in the same pathway that is affected by this virus. So you can see that's why initially there was an initial concern when this virus came along that, oh, is anybody taking those medication? Are they at a higher risk of severe infection?
Yeah, those are ACE inhibitors.
Exactly, they are ACE inhibitors and ARBs, they are called. So there was an initial question, are they at necessarily a higher risk? But it turned out that they are not. And everybody should not stop their medication. They should continue taking their medication. And if they have any additional concern, they can talk to their doctor. But the medication should still work and probably may even be a little bit protective against severe COVID. But additional data are pending.
We are out of time, Doc. Thank you so much. I hope we can still pursue this further. I want to say please say a big hello to Fatih and the kids. And you will. Okay, good. And then we will be seeing you soon again. Thank you, folks, for joining us. We will see you again next week. God bless.